I'm basically just going to give you an overview of the screening program. I'm going to talk a little bit about the eligibility to be in the program. I'm going to give a population perspective of cervical cancer, and then I'm going to give a very brief overview of a pilot project that we're doing in the Illinois Breast and Cervical Cancer Program. And I'm happy to answer any questions after if you have any. To improve access to screening for low-income and uninsured and underinsured women, Congress passed the Breast and Cervical Cancer Mortality Prevention Act of 1990, which guided CDC in creating the National Breast and Cervical Cancer Early Detection Program. And currently, the program funds all 50 states, D.C., 5 U.S. territories, and 12 American Indian and Alaska Native tribes. In 2000, Congress also passed the Breast and Cervical Cancer Prevention Treatment Act. This gives states the option to offer women in the program access to treatment through Medicaid. To date, all 50 states and D.C. have approved this Medicaid option. In order for a woman to be eligible for this option, she must have been screened for and have been found to have cancer through our program, under 65 and uninsured and not eligible for Medicaid. So who is served by our program? Well, federal guidelines establish an eligibility baseline to direct services to uninsured and underinsured women at or below 250% of poverty level. And for cervical cancer, it's 18 to 64. Since 1991, the national program has served more than 3.8 million women, provided more than 9.5 million breast and cervical cancer screening examinations. We've diagnosed over 130,000 premalignant cervical lesions, with 41% of those high grade, and 2,716 invasive cervical cancers. So although those numbers sound like a lot, we're talking about millions, but this is over the last 20 years, and this number really represents a small percentage of those eligible due to limited funds. And this kind of gives you a picture of that. This provides a population perspective for cervical cancer screening. During 2004 to 2006, approximately 93 million women 18 to 64 years of age resided in the United States. Of those, almost 9 million were deemed eligible for the program, so that's about 9%. During this time, 775,000 women were screened by the program. That's less than 1% of all women 18 to 64, and we're only reaching about 8.7% of those eligible. Again, that's due to limited funds. What we do provide, though, is direct screening services, which includes the Pap test, and we reimburse for both liquid-based and conventional. Pelvic exams. We reimburse for the HPV test according to the ASCCP guidelines for management and surveillance, other diagnostic testing, and referrals to treatment. And in addition to direct screening services, we also have the promotion side of the program, which now, as we're moving into the healthcare reform, we're really starting to move our research into this area. So the program also does public awareness and education, outreach and recruitment, professional development, quality assurance, quality improvement, surveillance, and evaluation. So our policy on the HPV test, as I said, we do provide the HPV test. We reimburse for the HPV test for management of an ASCUS PAP or surveillance after a CIN, but currently we do not reimburse for the HPV test as a co-test, so an HPV test with a PAP test, as it is approved by the FDA for women over 30. And the reason for that is back in 2005, we had an expert panel that came in to determine what should be reimbursed at a national level. And as you know, adding an HPV test adds about $75 to your screening. At the time, the expert panel wanted to see data on what providers were doing. And at that time, providers were still doing annual Pap tests, even if the woman was eligible to move to that 3-year screening cycle with the 3 normal Pap tests. So what the panel recommended was a demonstration project regarding how would providers and patients, the acceptability of this co-testing. Would they use it appropriately if it was provided for? Based on the expert panel recommendations, we conducted this CDC cervical cancer study, which we're calling CX3, and it's an intervention study in Illinois, in the Illinois Breast and Cervical Cancer Program. And the results of the study will provide information regarding the extent to which providers are willing to extend the screening interval if a woman is found to have a normal Pap test and a negative HPV test. So we designed this study as an intervention to determine whether provider and patient education will lead to extended screening intervals for women who have the negative tests. Both groups, the intervention and control, were given the HPV test so that cost was not a barrier. The intervention group was given a multi-pronged education, which I'm going to talk a little bit more in the next slide. So these, we chose 6 federally qualified health centers in the state of Illinois. All of our providers are part of the Illinois Breast and Cervical Cancer Program, representing a variety of specialties. And the women are coming in for a routine cervical cancer screen. So the women come in, and if they're enrolled in the study, they get their normal Pap test through the program, and then they take a second specimen and have their HPV test. That's sent to CDC HPV lab, who does the test, reports it back to the provider so that the provider can give the woman the results based on her Pap test and HPV test. And we're doing surveys throughout and following her for the next 3 years. So this just gives some of the provider intervention that we're doing. We kicked it off in 2009 with the Grand Rounds. We've had 4 academic detailing sessions, and we had podcasts with experts in the field. So to date, we've completed our educational intervention. We've completed our survey for the clinics, and there were 14 total in those 6 federally qualified health centers. We've completed a baseline survey for the providers, as well as we're right now working on the 12-month. We still have a 24-month and a 36-month. And we finished our baseline patient enrollment in May. So currently we've got about 2,000 women enrolled in the study. And right now, we have 90% of women that are Pap normal and HPV negative. So thank you.